This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. Dave Wilson with you. Our guests this morning, Dr. John Sunyecz and Dr. Christine Wilson, Mon Health Gynecology in Hopwood, Pennsylvania. Good morning, guys.
Good morning.
Well, thanks for taking a few minutes. We're obviously going to talk about some of the gynecological services offered through Mon Health. But first, I know we've had you both on the show in the past, but we always like to give you a chance to reintroduce yourself to the audience. 1, 2, 3, 4. I'll start with Dr. John Sunyecz. Just give us your background, education, training, how you ended up with Mon Health.
Sure. Thanks for having us. So I went to medical school at Ohio State in Columbus, and then came over to Pittsburgh to McGee Women's Hospital, part of UPMC, to do my residency and training. After I finished that up, I came to Uniontown and started practicing, and have been here ever since. In 2019, Dr. Wilson and I joined Mon Health. I think personally I was attracted to the philosophy of providing the best care for the community that Mon Health has, and I wanted the opportunity, and we both have been pleased with the opportunity to join their team for our patients. And
Dr. Wilson, no relation. At least I don't think so. It's possible. No. It's West Virginia. Go ahead, your background.
Well, I'm Wilson by marriage, so it's definitely no relation. But hi, thank you for having us. I actually did undergraduate and medical school in Morgantown at WVU. I left and went to York, Pennsylvania, to York Hospital, which is now called WellSpan Health, to do my residency, and then was looking to come back towards West Virginia. My husband's from West Virginia, and it was a perfect fit to come and join John here in Uniontown. And we've been in practice since I came here in 2000. But then, as he said, in 2019, the two of us joined Mon Health. So this coming September will be 3 years with them, and it's just been great working with them. We have very similar philosophies on how we take care of patients, and I've been very happy with being able to continue to offer the services to patients that we always have, just doing it through Mon this time.
And Christine, what led you to this specialty?
Well, I really enjoyed, actually when I was going through medical school, I enjoyed women's and children's health. I really liked pediatrics also, but ultimately I liked being able to do surgery, and I really liked being able to empower women to take control of their own health. Too often I think women take care of everybody else, their families and their friends and their parents, and we put ourselves on the back burner, and I really like being able to help women empower themselves to take care of their own health. And
John, same question to you. What brought you to this specialty?
Yeah, I think, I mimic what Dr. Wilson said. I think a lot of us aren't in this specialty would give you a similar answer, but, going through training, we get the opportunity to do general surgery, to do like internal medicine, family practice, and kind of OBGYN is the marriage of both. You get to take care of a lot of the medical sides of issues from a GYN perspective, if you will, but then you're able to take care of that by providing the opportunity to do surgery on those patients if they need it, and help them feel better and provide overall care for them throughout the continuum. So you see patients, and I've seen patients now for 20 years consistently and regularly, so they almost become like family to you, and I like that continuity of care as well. So I think all of those things brought me to this specialty.
Before we get to our first break here, I want to cover one of the most basic questions I'm sure you are asked all of the time. At what age, and John, I'll toss this one to you, when should a woman, or I guess a girl, teenager, whatever the case may be, when should a patient go to the gynecologist for the first time?
Yeah, that's a great question. I hear that all the time, especially from parents that have younger daughters. And so the answer as far as pap smears, because that's a lot of the times the questions patients will ask is, when do I need my first pap smear? And that is at 21 years of age, but we see patients generally younger than that. And so patients that are having irregular menses, patients that are becoming sexually active and need advice on counseling regarding birth control options, as well as if their patients are having any irregular problems, or if they are sexually active and need to be screened for sexually transmitted diseases. So at whatever age that is, that's the appropriate time to see the gynecologist. But otherwise, the average or the age for the first pap smear and exam would be at 21.
And Christine, how often do you recommend patients come see you? Is it an annual basis, semi-annual, every couple of years? How often?
Yes, we typically do recommend annually patients coming to visit. I think there's some confusion because in recent years we've stopped doing pap smears annually because of the way some of the technology has changed and improved, and just our knowledge of HPV. So that, I think, is a huge point of confusion for some patients. They feel like if they're not getting a pap, they don't have to come. But there's a lot of other things that we can look for, evaluate for, and diagnose and treat annually, even if they're not having a pap smear.
Dr. John Sunyecz and Dr. Christine Wilson, Mon Health Gynecology, Hopwood, Pennsylvania, joining us on the program this morning. And we will continue with our discussion right after this. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. John Sunyecz and Dr. Christine Wilson, Mon Health Gynecology, Hopwood, Pennsylvania, joining us this morning. And guys, we had just kind of started into the basics of the topic. Dr. Sunyecz, what are some screenings you would perform during a routine visit?
Well, it's a good question. So, usually for routine visits, obviously we'll just have a discussion with patients if they're having any concerns. The physical exam is important, an overall physical exam, but also including a breast exam and a pelvic exam, screening for any abnormalities in those regions. We also provide pap smear screenings, as Dr. Wilson mentioned earlier, during exams at the appropriate interval. We also, as patients get older, are integral in screening for osteoporosis and preventing bone loss and providing education on bone health. Pelvic floor dysfunction, we're going to get to that a little bit later, but patients that are having issues for anything related to the pelvic floor, that can be leaking of urine, pelvic prolapse. And then for patients that don't routinely see their primary care physicians, we discuss routine screenings for like lab testing, cholesterol, lipids, thyroid testing, things such as that if they don't have a PCP that they routinely see. And then, of course, gynecologic issues, endometriosis, fibroids, irregular bleeding, or menses are all things that we screen for during an exam and a visit.
Dr. Wilson, in the previous segment, I'd asked about when should a patient start seeing a gynecologist. And and this is across the board with any doctor, in my opinion, there's apprehension going into the appointment, and we tend to build it up and make it a whole lot worse than it has to be before we go. So put some folks' minds at ease, whether parents or young patients who may be coming to see you for the first time. Is it as bad as they make it out to be?
Definitely not. Essentially, when I have young girls who are coming in because they're having issues with their periods and that kind of thing, the biggest, I think, detriment to coming in is the fear of the speculum exam. And I try to put their mind at ease by explaining to them if they're young and they're not sexually active, so therefore not at risk for sexually transmitted infections, they don't necessarily always need a speculum exam. Also, one of the benefits of coming to a gynecology office is we have 5 different sizes of speculum. So the first thing I do to put their mind at ease is I show them all of the speculums, the tiny little pediatric speculum all the way up to the largest speculums, and help them understand that they're not going to be getting that large speculum. And that, I think, helps really put their mind at ease and helps them realize it's not as bad as they think. And then basically we just go through, depending on what their individual symptoms are, and most patients, just with as we talk with them through it and they understand it afterwards, almost all of them tell me it's not nearly as bad as they had envisioned it to be.
And Christine, why is the visit to the gynecologist, the OBGYN, important to a woman's overall health?
Well, there are a lot of other health problems that can affect your periods, and many women don't necessarily recognize it. So by coming to us and kind of going over their menstrual history and their gynecologic care, sometimes we can identify other issues and other problems. Again, as I mentioned earlier, too often we're the only doctor that women are seeing because they're not necessarily seeing a family doctor or a primary care doctor routinely because they're too busy taking care of everybody else. So we can identify sometimes other health issues just by seeing them and doing a physical exam.
Yeah, and John, Christine brought up a point there I wanted to ask you. How common is it that your patients, you are the only doctor they see on a regular basis, and they may not be keeping up with visits to the primary care physician? John?
Yes. Yeah. No. I agree. I'm sorry. I thought that was a comment, but yes, we see that all the time, especially during the pandemic. It was amazing how many patients would still desire to be seen for their routine gynecologic care, but when you talk to them, they mention the fact that they stayed away from their PCP because they didn't want to expose themselves potentially to the coronavirus and COVID, but they still felt it was important enough to come to their gynecologist for their routine exam, and that offered an opportunity for us to fill in some of those gaps and identify potential problems and offer screenings to those patients. And that happened before the pandemic, but was really highlighted during the pandemic and has persisted since then.
And you're right, John. It was more of a comment than a question. That's an error on the host on this end.
Okay.
Dr. John Sunyecz and Dr. Christine Wilson, Mon Health Gynecology, joining us here on Mon Health Talk this morning. And before we take our next break, I want to get into some of the services that are offered at Mon Health Gynecology, specifically the Hopwood location. John, what kind of services are offered there?
Well, I think, we are a gynecology-only office, so we tend to be able to see patients. We have a lot of time-filled time slots available for problem visits for gynecologic care. So I think we offer timely visits with Dr. Wilson, myself, and our mid-level APP practitioners. We offer the screenings we had talked about during exams. We have a laboratory testing opportunity here within the office, so we have phlebotomy available for patients that need to have laboratory testing. And we also provide osteoporosis screening. We have something called a DEXA unit that is the screening tool for osteoporosis, so we're able to provide those services for patients as well.
Dr. John Sunyecz, Dr. Christine Wilson, Mon Health Gynecology, Hopwood, Pennsylvania. Got to squeeze in a break, and we'll continue our conversation right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. Christine Wilson, Dr. John Sunyecz, Mon Health Gynecology, Hopwood, Pennsylvania. And Dr. Wilson, can you explain what is Coloplast?
Well, Coloplast is a company that offers various options for pelvic prolapse surgeries, incontinence surgeries. They have various products, and we work with them in utilizing several of their products for treating patients with pelvic prolapse, stress incontinence, things like that. And
John, what makes this treatment, what sets it apart from past treatments?
Well, there are many options available for patients that have pelvic prolapse, that have symptoms of stress or urinary incontinence, and Coloplast and the products that they provide actually offer a number of options. And after an appropriate exam, discussion with patients regarding their symptoms, oftentimes the Coloplast product line is one that we use because of its success. The data and the studies that have shown that their products do stand out as far as helping to give long-term results for these patients.
Christine, generally speaking, who is the ideal patient for one of these procedures?
Well, most of the pelvic prolapse patients are older. They've had several vaginal deliveries, or they do a job or have worked a job for many years where they had to do a lot of heavy lifting, straining, things like that. And so the majority of our patients are older that need these kind of surgeries. There is an option of trying non-surgical treatments with pessaries, and John and I both have lots of pessary patients, and that's a non-surgical option that we try, but invariably, eventually most patients move on to the surgical treatments.
And John, what can a patient expect before, during, and after the procedure?
Well, oftentimes, patients are unsure if the symptoms they're having are related to a gynecologic condition. So, low back pain, pressure, pelvic discomfort, pain with sexual relations. I guess patients' expectations before would be, the symptoms that they are experiencing, and if that is truly related to a gynecologic condition, if it's related to pelvic floor prolapse or issues related to that. And then, as I mentioned earlier, after an appropriate consultation, discussion, exam, we can talk and discuss which treatment options would be best. And then hopefully after treatment, they're going to have resolution of their symptoms. They're going to stop leaking. They're going to have less pelvic discomfort, less pressure. They're going to not feel that bulge that they may have felt for a number of years. So the goal is to recreate or correct any physical problems that lead to those symptoms.
Got about a minute, Christine. How can people reach out to learn more or make an appointment?
Well, we are on the Mon Health website at monhealth.com/OBGYN, and we're listed there as providers. Also, our office number is 724-437-2147. So either of those options would be able to get you in touch with our office to be able to make an appointment.
John, she left you about 30 seconds. Anything you want to add before we have to go?
No, I think we talked about everything that needed to be discussed regarding pelvic floor, but I'm sure there are other questions, and so I would encourage patients to give us a call or talk to their other Mon Health provider that would be able to answer their questions and or give a referral to us if necessary.
Dr. John Sunyecz and Dr. Christine Wilson, Mon Health Gynecology, Hopwood, Pennsylvania. Of course, you can always get more information. Go to the website, monhealth.com/OBGYN. Guys, thanks so much for joining us here on a Monday morning. Appreciate it.
Thank you.
Thank you for having us.